and Displacement Coordinator, based here in Kuala Lumpur, Malaysia, and like about a third of the planet right now, working from home. We are very pleased to be also joined in this Red Talk by two brilliant colleagues. Firstly, Himya, the new Secretary General of the Maldivian Red Crescent, joining us live from Male, the capital city of the Maldives. Good evening, Himya. How are you?
Thank you, I'm fine.
We are also very pleased to be joined by Achala, the head of delegation for Bangladesh from the American Red Cross. Achala is joining us live from Cox's Bazar, the location of the largest refugee camp in the world. Good evening, Achala. How are you?
Very easy. Thank you.
So this is a live conversation, and like all of the Red Talks, this is streaming across all of our platforms, YouTube, Facebook, Twitter, and LinkedIn. But this is not just a conversation between the three of us. This is a conversation with all of you. So please feel free to send a message, send a comment, let us know where you are listening from, and make a question for Himya, for Achala, or for all of us. So first of all, why are we talking about COVID-19 and refugees and migrants? The COVID-19 pandemic is clearly challenging all of us. Its health costs, its social costs, its economic costs, its personal costs are enormous and will continue to grow. However, for many migrants and refugees around the world, COVID-19 presents an almost unimaginable threat. In overcrowded refugee camps, in slums, in low-cost migrant housing around the world, many migrants and refugees are already living without access to fresh water, without access to decent healthcare, and without the luxury of being able to maintain social distance. For other migrants and refugees, especially those who are undocumented or those who are living in the shadows of our communities, they may not have the right documents to be able to access public health care. They may be unable to pay or afford private health care. They may be invisible from our plans, invisible from our priorities, and fearful of coming forward and asking for treatment and asking for help. For others still, especially the millions of migrant workers around the world, those people who move abroad to make a living for themselves and to support their families at home, they may now be trapped, unable to return, fearful of the unknown, and facing the prospect of losing their job, their livelihoods, far from home, far from family, far from support, and living in fear of the future and fear of this virus. So first of all, we can start with Achala, live from Cox's Bazar, Bangladesh. Achala, could you please describe for us what is happening in Cox's Bazar? What is the situation there, and what is the situation with COVID-19?
Yeah, thanks, Sid. Just to maybe do a quick overview of Cox's Bazar. Cox's Bazar is in the southeastern side of Bangladesh, bordering the Myanmar. And as you highlighted in Cox's Bazar, we have the host communities that are hosting close to 850,000 displaced people from Rakhine. Mainly, most of these people, close to 700,000, moved here in 2017, August. Of course, we've had displaced people from Rakhine in previous years as well, and some of them have been refugees in Bangladesh since 1992. So there's a quite a big population that's in a densely populated area. What has happened over the last 2 years is the government, with the humanitarian agencies, including the Red Cross, Red Crescent, have been able to support this population to settle down and come to terms with living in this area, even though it is dense. It's like becoming almost like a city because it is the world's largest refugee camp. settlement. It has 34 camps. When you talk about camp settlement, there's 34 camps. Some of the camps are dense, some of the camps are not so. But it is an area where we do have to consider social distancing and all these other aspects of COVID a little bit more difficult to manage. Also, we need to highlight the host communities are also living close to each other. There's a 500,000 Bangladeshis who live close to the displaced community. So it's a quite a big community of people who are concentrated in one area, and that's why the government and the humanitarian community are working in like more attention in Cox's Bazar. Of course, there's a lot of attention for Bangladesh as well, but a specific focus on Cox's Bazar. Situation right now, we don't have any confirmed cases as such. Mostly, currently, we are working on preparedness measures and to ensure mitigation measures in the broader environment of the district, and then specifically for the host communities, and then for the displaced communities within their own camp settlements. Again, this is an area where not many health facilities are available. So again, we have seen globally how the health facilities are overwhelmed. So there's a rush for getting some isolation and health facilities prepared in time for if there is a major.
Thanks, Achala. So now we can turn to Himya. Himya, can you let us know what is the situation in the Maldives? Why is COVID a risk for some of the migrant workers there?
Thank you, Zeke. Let me first give you a brief overview of the migrant situation in the Maldives. Migrants account for a significant part of the population of the Maldives. The total population of our country is around 400,000, out of which an estimated 100,000 are foreigners or migrants, and out of which 35,000 we are estimated to be undocumented workers. A very few percentage of this is female workers, about 20%, so the rest are male workers. And then a huge percentage of this workforce or the migrant population is residing in the capital city here in Male, which is already quite densely populated. Migrants are dominant in the workforce, mostly catering to the booming construction industry and also in the tourism industry of the Maldives. Most migrants are from neighboring countries such as Bangladesh, Sri Lanka, India, and mainly a huge percentage is from Bangladesh. They are also exceedingly vulnerable to exploitation due to the condition of living, due to low wage, and also because most of these workers are also undocumented. After they come, they shift from one employer to the other. There are various issues that are concerning currently, protection and human rights from a protection and human rights standpoint. Dire challenges that we are facing, such as security of livelihood, people who are working on day wage, due to the disruption of work and lockdown situations in the country. They are unable to go out and get work on a daily basis. So we have a lot of challenges facing, especially for these workers in the country at the moment. In addition to this demographic, there are also other migrant workers who are working in areas such as domestic work. These are women mainly from South Asian countries. They work as maids in the houses, and these are also a small migrant population that we find it difficult to reach, given that even currently in Male we have a curfew time from evening from 5 till 8 in the night. And also offices are closed, cafes has been closed down, so there's lots of restrictions of movement. Hence, communication is definitely an issue we are facing currently. And in addition to that, the COVID-19 situation, we have currently 19 positive cases, but we do not have community spread at the moment. All these cases are imported cases, and we have about more than 800 people in quarantine facilities currently. So I think that's kind of the overview of the situation with us in the Maldives right now.
Thank you, Himya. I think we can see that both contexts are extremely complicated, like many places around the world. Something that we as Red Cross and Red Crescent have really recognized and been focused on a lot for migrant and refugee communities is that reliable information can really save lives in this crisis. We're in an era where there's a lot of information available, but what people really need is trusted, reliable information. So it's a question for both of you. Maybe Himya, you can start. How are you sharing information with migrants in the Maldives in a way that is trusted and reaches them?
Right. Um, I think disseminating reliable information to migrant workers has been one of our foremost priorities. We actually started information dissemination on COVID-19 itself somewhere back in February. So as soon as we heard of the outbreak in China, we started information dissemination at different levels in our branches, in our islands, as well as the capital city. Um, this is something at a national level that the Red Crescent volunteers have been trusted with by the government and other agencies, because we are placed well within the communities to reach to these migrant workers and to give this information to them. So right now, how we are doing it, we've been using many methods, such as I think the one we would really like to highlight is conducting information sessions targeting migrants, where we use migrant volunteers to facilitate the sessions in their local languages. I think it's very important to get the awareness messages across to the people in their local languages, because sometimes when we distribute leaflets or posters, people find it difficult to understand, because a huge percentage of these unskilled workers could possibly be illiterate as well. So we've been conducting these sessions, and we are continuing the sessions as we speak currently, even of course taking into consideration the social distancing aspect, and we are bringing in people in smaller groups, like 20 to 30 at a time. So how we are doing this is we are contacting these companies where they have hired the migrant workers, and we are bringing them for these information sessions. And I think it's been quite successful, because it kind of gives a platform for the workers to speak out, to clear their doubts, and to interact with one of our volunteers who's also from their own community and their own country. We also had done a door-to-door dissemination, but of course, following the positive case in Maldives, we are no longer conducting door-to-door sessions. When we used to conduct door-to-door sessions, our volunteers would go to the accommodations of these migrant workers and then disseminate the information to them. The other way we are currently disseminating information is using vehicles, and with loudspeakers fixed to the vehicles, they go around the city, giving in information on hygiene promotion, physical distancing, the importance of staying in, and social distancing in five different languages currently. So these vehicles go out during different times of the day and night, and focusing on areas where the migrant workers have accommodations. So I think we have to think of new and innovative ways of getting the messages across, since due to social distancing, we are unable to send our volunteers into the communities. So I think those would be some of the key ways we are, and of course, in addition to that, social media messaging and sending out text messages through the telecom companies in their languages to these people. So we are getting a lot of support from the government authorities as well, and as well as these telecom companies, and reaching out to these people. I think that would be from our side. Yeah.
So you're doing a lot, Himya. Thank you very much. Before we move to Achala, I just want to remind people this is an online Red Talk focused on COVID-19, refugees, and migrants. We have a lot of listeners and viewers from all around the world. Thank you for joining this conversation. We have friends from Turkey, from Bosnia, from the United Arab Emirates, from Iraq. We have friends joining from Pakistan, Italy, the United Kingdom, Jordan. We have friends from Spain, Burundi, Kenya, Australia, Italy, and Aruba. So thank you very much for joining. Before we ask the same question to Achala, we have a question for you, Himya, from Krishna. This is via Facebook. Krishna is wondering whether you are able to help any of the migrant workers with some basic supplies and support like that. That's from Krishna on Facebook.
Yes. Thank you, Krishna, for the question. I would like to tell you that we are in discussion on actually creating care packages for these migrant workers. But like I told you, it's about 100,000 people we're talking about. So we need to identify the most vulnerable and ensure that we are giving out these supplies to the people who need it the most. We are in conversation with different international organizations and also the government on who might be willing to support us financially as well to do something like this. So yes, it's being considered, and hopefully we will be able to give some basic supplies to these migrants in the very near future. Thank you.
Thanks, Himya. And so over to you, Achala. Achala is our colleague based in Bangladesh. He is right now coming to us live from Cox's Bazar, Bangladesh, where there are more than 850,000 refugees and displaced people living in large refugee camps. But as Achala reminded us, there's also a large number of people, Bangladeshis, living side by side with these refugees who are also affected. So Achala, how are you in such a complicated location and such a complicated setting as that? How are you providing information to these communities, trusted information?
Thanks, Zig. For the approach that is being taken by the Bangladesh Red Crescent is very similar to what Himya was highlighting. It is also using the Bangladesh Red Crescent volunteers who reach out to the communities. So especially in the host communities, there are a number of different types of volunteers, Red Crescent youth volunteers, that's cyclone preparedness program volunteers, who also have been repurposed to take the messages of COVID and social distancing, hygiene promotion, some of those messages to the communities. And that's the strength of the Red Cross movement, to be able to go down to the grassroots level, because the volunteer base is from the grassroots. When you talk about the camp settlements, again, Bangladesh Red Crescent and the Red Crescent partners have a number of volunteers who are working from the displaced community. So that is where, again, we use those volunteers, take the messages. Again, very much similar to what was mentioned, it has to be based on trust, and it has to be based on a language that people do understand and relate to. And over the last 2.5 years, again, to the credit of the humanitarian partners and the Red Crescent, across the 34 camps, there are more than close to 4,000 volunteers from this displaced community who have been taking different messages like cyclone preparedness messages, other health messages, health mobilization. So these people have all been mobilized to take the messages of COVID from a house-to-house level, leaflets, posters, all of this done with the Communicating with Communities working group, which is also a broader group of humanitarian partners, and making sure the Rohingya language is used, and it is done on a face-to-face basis at a household level, because it is not just sharing information, Aziz, it's also convincing people why they have to do some of these things, because a lot of the time it is an unknown threat, and a lot of the time people don't take it maybe seriously if you just share a leaflet. So it is important the background information is shared, and the importance of that is highlighted by trusted sources. So that's it, again, having those trusted volunteers from their own communities who've been giving the trusted information previously, now being again repurposed to share COVID. So that's the in addition to that last point, I would say we are also using what we call the kind of the tuk-tuks that are with a speaker type of thing, which is taking a mass media message again on the Rohingya language, to make sure that all the camps and all the people are reached. At this point, I understand almost half of the population has been reached by different partners. So this is a big achievement from the Red Crescent in Bangladesh.
Thank you both. I think that raises a really excellent point about not just having Maldivian volunteers or Bangladeshi volunteers in Bangladesh and the Maldives, but really also having volunteers from these communities that we're working with and for, migrants as volunteers, refugees as volunteers. We have a question from Samantha from Grenada. This is also via Facebook. The question is, as with many of us, there are worries about COVID-19. We are worried about catching COVID-19 and succumbing to this virus. How do you address some of these worries, and how do you alleviate some of these worries of the volunteers? Maybe we can start with you, Achala, and then move back to Himya.
Jose, so again, this is also having the right information with the volunteers so that they are aware of the risks and making sure the necessary PPE is there. And again, it is not only, it is also practicing what you preach, because even the volunteers who are going to these camps or households, they need to practice washing hands, making sure that they are ensuring social distance. So as an organization, the Red Crescent has come up with a process making sure there is social distancing, there is a focus on safety, and PPE is available to the people who are engaged in the frontline work. Of course, this PPE use and need will continue to grow as this crisis evolves. And this is something I think all the countries need to focus on and get more and more in stock so that we don't run out of it and we don't have volunteers who are exposed. I think that's something we are making sure the safety of the volunteers from the Red Crescent. So again, I hope that.
Thanks, Achala. And Himya, how are you, as the Secretary General of the Maldivian Red Crescent, a new leader for your local Red Cross and Red Crescent there in the Maldives? How are you approaching some of these worries or concerns that the volunteers may have about COVID-19?
Yes. I think the first and most important point is to communicate well to the volunteers and to provide them with verified, reliable information, and to inform them of the risk involved before they go into the forefront. So, and then to give them a choice whether they are willing to go and work in the forefront given the risk that involved in such situations. And the second most important thing, like Achala said, I think, is to provide proper PPE. Currently, with our Red Crescent volunteers, it's a handful of volunteers who are involved in the forefront, and we ensure that they have the proper PPE. But like the question said, it's very unfortunate that it's not the case in all the countries currently. There are many countries that lack proper PPE equipment and therefore are unable to provide it to the volunteers. And I think that is very unfortunate. However, Maldives and the Maldivian Red Crescent have been quite lucky because we are equipped with the PPE for now, and the government is also providing us the proper PPE for the volunteers currently. And I think we also need to ensure that the volunteers are taken care of well, especially these volunteers who go into the forefront, who risk their lives, provide them with the psychosocial support they need afterwards, and to ensure that they are well taken care of because they are risking their lives for us and our people. So I think that's our top priority currently. We are continuously in negotiation with the government as well, highlighting to them the importance of having PPE with us as well, so that we can provide it to the volunteers whenever it's needed. So I think that's currently from our side.
Thank you, Himya. We are receiving many questions online. For those who have just joined, this is a COVID-19 Red Talk focused on refugees and migrants. We're joined by colleagues in Bangladesh and the Maldives. We are receiving many questions via LinkedIn. Mohammed has a question. He's in Yemen. that might apply to some other countries as well. Maybe this is a question for you, Himya. He is very worried about migrants who want to go back home, but may not be able to now. Maybe the flights have stopped, maybe they are under quarantine, or other border closures or restrictions mean they cannot go home. Have you seen that happen in the Maldives? Is there any support that you can provide to these people? Thanks, Himya.
Yes, thank you. I will talk about the undocumented migrants to begin with. The government of the Maldives had actually publicly announced that the government is willing to support any undocumented migrant who wishes to go back to their country. So there is a registering mechanism ongoing. About 300 people have registered, informing that they would like to go back to their country. But like Mohammed has raised the question, the real question is how are they going to go back, because the borders have been closed. Even currently to the Maldives, we do not have any flights either coming in or going out at this point. There might be very few, but definitely not to Bangladesh or the countries that these migrants are from. So at this point, though there's mechanisms internally within Maldives trying to get these people out of the country back to their homes, unfortunately, I have to say, due to the lack of movements of the flights and borders being closed, we are unable to do it right now. But I believe once the situation gets better, we are working with the government to ensure that those people who wishes to go back to the country are able to do so.
Thank you, Himya. And we now have another question also via LinkedIn from Eman. This is a very straightforward question. I guess this is for you, Achala. Do you have the capacity to handle cases if they come up in Cox's Bazar?
Thanks. Yes, I think that this is an evolving situation. So the WHO, with the humanitarian community, with the government, Bangladesh civil surgeon, and the respective partners are taking actions. Various measures are being taken from mitigation measures as well as treatment. So the capacity of the local hospitals are being increased at a very rapid pace. A lot of isolation facilities are under preparation, and this is a collective effort of a broader number of humanitarian partners. Obviously, the Red Crescent has a role, a very important role, but collectively, I think there are preparations underway if there are cases how to address it. From a government side, it must also be highlighted the testing capacity was also decentralized to Cox's Bazar to support some of these efforts. So from the government side, so yes, preparations are being put into place. Again, as everywhere else, we all know if there is a larger outbreak, obviously most of the health facilities will be overwhelmed, maybe. But at this time, it is a preparation phase for Cox's Bazar.
Thanks, Achala. And another question also via LinkedIn. I think LinkedIn is definitely having the most questions at the moment compared to the other platforms. This is from Eli. He says that one of the cascading issues, or one of the issues that humanitarians are seeing because of COVID, is related to food supply. Are you seeing any specific issues either in the Maldives or in Cox's Bazar, Bangladesh, related to food supply shortages connected to COVID? Maybe we'll start with you, Achala, and then move back to Himya.
Yeah, so from a food supply perspective, especially for the camps, the World Food Program has been working there for a longer period. They have the whole process that is running, and at this point, it is something that is continuing. So we don't see a problem with the food supply at this point, specifically to the camps. But if you talk about generally Bangladesh and the host communities, the Bangladesh Red Crescent is focusing on providing some of the food to at least 75,000 households across the country through their own efforts. So again, it's not just looking at the displaced community, but also looking after some of the Bangladeshi communities that are also vulnerable in this case, and making sure all the people who are vulnerable are covered when it comes to food supply.
Thanks, Achala. And Himya, is that an issue that we've started to see in the Maldives, food security connected to COVID?
Currently, no, because the government has taken already measures in to control the food supply, and though we do not have flights with passengers coming in, cargo flights are being already conducted from other countries to bring in the food necessary for the people, but as you would know already, Maldives is a country which is highly dependent on imports. About 70 to 80% of our food supply is dependent on neighboring countries and other countries. So if the situation extends for a longer period of time, government is already thinking and taking measures, taking into consideration that there could possibly be a shortage in the longer future, but not at the moment. And whatever food is available, it's also available to the migrant community as well. But again, the issue would be whether they are able to get the wage necessary to buy these food, because people who work on the daily wage might not have the money anymore with them to go and actually buy the food.
Thanks, Himya, and that's an excellent point. Achala, we have a question directly to you from Facebook this time. You talked a lot about the kind of information that you're providing to the communities in the camps. Do you have a sense of, is there any awareness of COVID amongst the refugee and displaced population? Do they understand the severity of this global crisis?
Yes. So in this case, the Red Crescent is working with the communicating with the working group that works on communication, who with BBC Media Action and a number of others who are looking at following up with the rumors, what is the understanding of the people, and trying to make sure that the information that we are sharing is targeted. And at this point, what we understand from the data that we are getting is people do understand, they do have concerns. And that is another part to go back to our previous messaging. It is not just messaging; it is having volunteers who are there to say, yes, this is a serious issue, but we are there to, as a community, we need to get through this. So, kind of being psychosocial support provision is another part of this whole process, where the Red Crescent has a huge role, and they're working with the IFRC and the partners to provide that support. So again, a lot of effort has been done by the Bangladesh Red Crescent nationally as well, setting up specific phone lines as such. But for the displaced community, it is again the face-to-face engagement from the volunteers and the psychosocial support teams that can provide that information as well, to make sure that people are, have the right information, but also are not getting traumatized by what they feel would be something that they don't understand. So it's making sure information is there, reassuring them of what is available, what services are available, and how to tackle them.
Thanks, Achala. And now a question for both of you, for Himya and for Achala. It feels like the whole world is stopped because of COVID-19 in lots of ways. But what we know is that other emergencies and other crises will not stop. Already yesterday and today, we have seen the impact of a tropical cyclone hitting Vanuatu in the Pacific Islands. It's now on its way to Fiji. We see the monsoon season and the cyclone season coming to the camps in Cox's Bazar, Bangladesh. So how are you both balancing addressing COVID-19 right now, this crisis that we have right in front of us, as well as trying to prepare for these future crises and future risks that we also know will happen? Maybe Himya, we can start with you if you have some reflections, and then move to Achala.
Yes, thank you, Zeke. Like you said, it's very obvious that the monsoon shifts are going to come in the very near future. Even for the Maldives, within the next coming months, we will be seeing these shifts where it's going to be the rainy season. Sea swells, flooding is going to be very common, especially in the remote islands. we are already preparing for it through our emergency response teams by training more emergency response team members, volunteers who will go out into the field and respond to these disaster situations. So I think it's important for us to keep in mind that this is not the only crisis or emergency we will face in the near future. So at different levels, and not only at the government level, but also within the Red Crescent, and also at the island levels, we are preparing for it. And I think it's important that while we can, like in the Maldives currently, we are not at an outbreak situation. So we have a very little time period where we can actually get more prepared, not only for COVID, but also, like you said, for other possible disasters. So we are taking the maximum, we're making the best out of this time we have, the limited time we have, to ensure that we are prepared for such emergencies in the future. So I think for all countries, especially those countries that are not facing an immediate outbreak of COVID-19, we should also focus on being prepared for such monsoon shifts in the future.
Thank you, Himya. And Achala, how are we beginning to address possible future crises, the monsoon season, the cyclone season in Cox's Bazar, Bangladesh?
Thanks, Nick. From a perspective of the cyclone season, because this is a seasonal aspect in the country, and we have two cyclone seasons, and in the middle with the monsoon season, Bangladesh always prepares for the cyclone season starting in April. So, like the COVID situation in early 2018, we were working as the Red Crescent. We were working on steroids, trying to set up a cyclone early warning system and bringing the disaster management systems into the camp settlements. And that was, again, a collective effort of all partners. In all 34 camps, there were early warning, early action, and response mechanisms that are managed by the displaced communities themselves. They're organized, at least there's a minimum of 100 people in each camp. And they've been responding to multiple hazards. They are recognized as cyclone preparedness program volunteers, thanks to the efforts of Bangladesh Red Crescent and the government, which also gives them recognition, so people listen to them. They've given early warnings, they've engaged in activities for the last 2 years. So right now, we are basically adding to what they are doing, the COVID awareness and COVID preparation. Of course, realizing the fact that not all the support mechanisms that were planned as contingency before may not be available from outside. And it is important that the camp communities themselves manage, in case of a cyclone, making sure the early warnings are provided, making sure early action is taken, and making sure response activities happen, because this is why the localization of these resources and capacities are important, and a critical role of the Red Cross Red Crescent movement, which the Bangladesh Red Crescent has done over the last 2.5 years. So on this issue, at least for the camp settlements, I would say we are a little bit more prepared, and adding COVID, of course, creates a little bit of more complexity to this situation.
Thank you, Achala. And just to say hello to friends who have joined from Macedonia, we have people from the United States, from Albania viewing and joining, from Nigeria, from Morocco, from Canada, from Nepal, and from Switzerland. Just before we wrap up, Himya and Achala, I thought you've answered so many questions on behalf of all of our friends and viewers around the world. Maybe it's an opportunity for you to pass on a message. Is there some message you would like to pass on to our volunteers around the world, to the other leaders of national, local Red Cross and Red Crescent in other countries, Himya? Is there a message you would like to pass, maybe starting with you, Himya, to volunteers and staff around the world?
Yes, I think especially being at the top of the organization, I just cannot describe in words how much we appreciate the work that's been done by our volunteers across the world, risking their lives, contributing so many of hours without sleep, without rest. And it's remarkable to say that we have such a united and dedicated team of volunteers and staff and members with us, and I would really like to thank each and every one of you. And we all stand in solidarity with other countries that's facing this terrible crisis more severely. We luckily, countries like us, the Maldives, we are still able to manage this, but countries like Italy and Spain and other countries, that the increase in cases day by day, I know it's going to be really challenging. All I would like to say is we are in this together and we need to fight this together. We can support each other, though we are now bound by boundaries, we still can support each other through such platforms where we can share our work, talk to each other and engage each other more. And I really would like to thank IFRC for this opportunity for me to share the work in the Maldives with the rest of the world. Thank you, Zik.
Thank you so much, Himya. And Achala, do you have a final message for some of the volunteers around the world working also at the front line of this crisis?
Thanks, Zik. I think for the different countries that are in different phases, I think time is a luxury. Whatever time we have to do what we can with the time that is available. So again, I'd echo what Himya said. A lot of gratitude for the frontline volunteers and staff, especially in Bangladesh, the Bangladesh Red Crescent volunteers and staff, but across the globe, we've seen that, and they are standing up to these challenges, not standing down when a lot of people have to work from home and kind of get accustomed to a different way of working. So a lot of gratitude and a lot of appreciation for the huge amount of effort and courage the volunteers and staff are putting across the world. We wish them well, and we will get through this together.
Thank you very much, Achala. So thank you very much to both of you, to Himya, the Secretary General of the Maldivian Red Crescent, live from Male, the capital of the Maldives. Thank you to Achala, the head of delegation for American Red Cross in Bangladesh, coming live from Cox's Bazar in the southeast of Bangladesh. Thank you to everybody from around the world who has been watching online. Please keep safe. Keep healthy, look after each other, wash your hands, and please keep watching online for future episodes of Red Talk on the COVID-19 crisis. Thank you very much.
Thank you.
Thank you.